I believe that there is a lot of convergence between the ancient medicine and the modern medicine. Let's scratch the surface of epigenetics and the long-term health effects. Recent research has shed light on the role of epigenetic modifications and changes in the gene expression that occur without alteration in the gene or DNA sequence in mediating the long-term effect of both modern therapies and ancient interventions. Stress, diet, and lifestyle factors can lead to methylation and acetylation changes that influence inflammatory responses and metabolic function. For example, yoga and meditation practices have been associated with beneficial epigenetic changes that reduce the expression of genes linked to stress and inflammation. Similarly, Ayurvedic dietary recommendations and herbal modulations and formulations are believed to exert epigenetic effects that enhance detoxification and immune regulation. This emerging field of epigenetics provides a common molecular language that links modern pharmacotherapy with traditional practices, highlighting how lifestyle interventions can yield the enduring health benefits. This is particularly relevant for the chronic stress, inflammation, and immune system. The core tenet in both modern medicine and ancient health system is the management of chronic stress, which is now recognized as driver of the systemic inflammation and immune dysregulation. Prolonged stress activates the hypothalamo-pituitary axis and leads to overproduction of cortisol, a hormone that in excess can impair immune function and promote inflammation in a different way. Modern studies demonstrate that interventions such as mindfulness-based stress reduction, yoga, and breathing exercise not only lower the cortisol levels but also modulate the cytokine profiles, reducing pro-inflammatory markers like interleukin 6 and tumor necrosis factor alpha. Ayurveda similarly targets these processes through lifestyle modifications and herbal remedies that are believed to balance the body's inflammation or inflammatory milieu are helpful. The convergence in these approaches underscore a shared recognition that managing stress is key to regulating immune responses and preventing the chronic disease. When we talk of the nutrition and nutritional strategies, and particularly integrative nutritional strategies, we know that modern medicine has a specific nutrition method and ancient traditional methods intersect through a different method. Modern nutritional science emphasizes that role of antioxidants, anti-inflammatory nutrients, and gut microbiome in maintaining health is necessary. Ayurveda's approach, which classifies food according to the energetic properties and effects on the body doshas, finds a parallel in modern concepts such as glycemic load, antioxidant capacity, and probiotic benefits. For example, species like turmeric and ginger staples in Ayurvedic cooking and are validated by research for their potent anti-inflammatory and antioxidant properties. These dietary interventions contribute not only to reducing oxidative stress, but also to optimizing gut health. Factors responsible and increasingly recognized as pivotal in preventing metabolic and cardiovascular diseases. I can say that integration of the ancient wisdom with modern medical research holds a promise for developing a comprehensive treatment strategy that is both effective and holistic. Future research is needed to further elucidate the biochemical pathways in influence of yoga and meditation and Ayurvedic interventions, and to quantify their clinical benefit in the large controlled studies. One significant challenge lies in standardizing these ancient practices to fit within the rigorous frameworks of the clinical research while preserving their individualized and holistic nature. Another challenge is bridging the gap between the qualitative assessments used in the traditional medicine and quantitative biomarkers favored in the modern medicine. As these challenges are addressed, the potential for integrative medicine to enhance the patient outcomes becomes increasingly promisingly higher, offering a roadmap for personalized therapies that respect both ancient insights and modern scientific rigor. The convergence of modern medicine with the ancient practices such as yoga and Ayurveda is thus evident in the shared focus on maintaining the homeostasis, managing stress, and reducing inflammation through the biochemical and epigenetic pathways. Both recognize the importance of nutrition, lifestyle modification, and natural compounds in influencing disease outcomes. By bridging the gap between the traditional wisdom and contemporary research, integrated medicine can offer more comprehensive and personalized treatment modalities, paving the way for the innovative strategies in prevention and management of the chronic diseases. Thank you.